This short video demonstrates a history-taking exercise with a patient presenting with gastrointestinal symptoms.
Good morning, sir.
Hi.
Dr. Burke was my name. Pleased to meet you. Can I ask your name?
John Smith.
And how old are you now, John?
43.
And what do you work as, sir?
I'm a secondary school teacher.
Okay. How can I help you? What's been troubling you?
Well, doctor, I've been having problems with my bowels. I'm actually quite concerned about. Yeah.
Okay. Would you like to tell me any more detail about what's been troubling you?
Yeah, well, really over the last 2 months, my bowels have been doing different things. You know, some days I'd have loose motions, and then some days I wouldn't pass any motions.
Okay, so for 2 months now?
Approximately 2 months, yeah.
Can you give me a little bit more detail, exactly what's been troubling you?
I've been having days where I get loose motions, and then I can go for maybe up to 3 or 4 days where I don't pass any motions at all.
Okay, and any other things that you've noticed yourself apart from that?
Well, really, over the last couple of weeks I've noticed a change of colour in my motions as well.
Okay, so how many times are you finding yourself going a day now?
Well, when my motions are loose, it could be up to 3 or 4 times per day, and then it can swing to days where maybe I go without passing a motion for 3 to 4 days.
Okay, and prior to that?
Oh, well, it was regular, once a day.
Okay. You mentioned about the motion itself, it was different in colour. Could you tell me more about that?
I noticed that they've become more dark, even like a dark red sort of colour.
Okay, and can you see any blood itself?
Well, I wonder if that is blood, but I can't see any, fresh blood per se, but this dark
so there's no blood on the stool or any red blood on the paper?
No.
But do you think that there could be some coating or mixed in with the motion that you've passed?
If possibly mixed in with the motion.
Okay, and any mucus at all? Have you passed any mucus, any slime?
I haven't noticed any.
You haven't noticed? Okay, any pain around the back passage?
No.
Any tummy pains at all?
Not really, no.
Okay, and do you think you could have lost any weight over recent weeks and months?
I don't weigh myself, but my family have commented that I look a little bit lighter, and even my clothes have got a little bit more loose.
Okay, and that isn't something you've been actively trying to do?
No, I haven't been trying to diet.
Right, okay. Anything else you've noticed at all?
Well, I have to say my energy hasn't been really that good.
Okay.
I've been quite sort of fatigued over the last 2 to 3 months.
Any problems with heartburn or indigestion?
No.
Any problems with swallowing at all?
No, that's fine.
And how's the appetite been?
Okay. Some days maybe I just feel that I'm not hungry and maybe eat a little bit less.
Right, okay, but nothing major?
No.
Okay. Have you had any problems with the bowels before, or the tummy at all for that matter?
No, this is fairly new for me.
Okay. Any operations on the tummy?
No.
Okay. And just going on, just to ask you a little bit more about your past medical history, have you had any problems that you'd like to let me know about?
No, I've been quite fit and well to date.
Okay. There's just a few diseases we like to ask everybody about. Have you had any problems with angina or valve problems with the heart at all?
No.
Any problems with the breathing, asthma or emphysema?
No.
Diabetes?
No.
Ever had jaundice in the past?
Never.
No. Okay. Just moving on to your family, any history in the family of any illnesses that maybe one or more persons had?
No, the family are pretty fit and well. My mother and father are still alive, and my brother and sisters, and they're fine as well.
And no problems with the bowel in the family?
No.
Okay. In terms of medications, are you allergic to anything?
I've no allergies that I'm aware of.
And you're on any regular medications at present?
No.
Any over-the-counter medications or herbal remedies?
I'm not buying any of those, no.
No, so pretty healthy up until now then?
Sure.
Okay. Do you live by yourself at home?
I'm married, with no family.
Okay. Would you smoke at all?
No, I don't.
And would you drink anything?
Maybe occasional glass of beer at the weekend, but nothing more than that.
Nothing major.
No.
And how would you consider your appetite to be?
My appetite, maybe not just as good of recent.
Okay. There's a few more screening questions we ask everybody when they're not been feeling very well. Any problems with shortness of breath?
No.
Chest pain?
No.
Any problem with the waterworks?
No.
Or any stinging on passing the water?
No.
Okay. Any dizziness, fits, faints, funny turns?
No.
Okay. So if I could just tell you what you've let me know so far.
Sure.
You've been having some problems for the last 2 months with the motions. Irregular in nature, sometimes can't go, sometimes more than regular. You think there could be some blood mixed with the stool, but no slime.
Yeah.
And you may well have lost some weight along the line. And up until now you've been perfectly well and healthy.
Yeah.
Okay?
Yeah.
Is there anything else you'd like to add at all?
No, I think you've got things well.
Okay, well we'll do our best to try and see if we can find out what's been troubling you, sir.
Okay.
Thank you very much.
Thank you.
Again.